He's going to jump on, Becky, but if you open the meeting and read that little preamble.
Yeah, Charlie's joining now.
There he is. Okay.
All right, so we're going to open up the meeting. It is 3:32 p.m. Good evening, everybody. This is being recorded. Sorry. All right, so I'm sorry, I'm using my phone and the computer and I'm not good at this. I told you guys. So we're just going to start with the agenda. We're just going to approve the meetings from last minute. If Caitlin and Charlie, if you guys had a chance to look at that.
Yep, everything looks good.
Charlie, how you doing?
Now that I'm unmuted, okay.
Mute him up again.
I like mute.
Oh, wait, is that? No, those are the minutes. Okay. Jerry, I'm sorry. What's the next thing on the agenda? I don't know if I accidentally deleted that or.
It's Trinity Solar.
Right.
Was the solar company, and I think I forwarded that to you.
That was a pretty big. Michelle definitely got back. That was a huge response from her regarding that.
Right.
So open the discussion to Trinity Solar for now. So thoughts?
I don't think it's in our wheelhouse to do anything relative to this.
I was actually wondering, I mean, in reading that letter, I was wondering if there is a possibility for us to even be able to say that they're not able to do that.
I don't think we have the authority to do that.
Actually, in the letter, she says you do.
I haven't seen the letter, Ed.
There was a door-to-door solicit. There was a letter that was today, the 18th? It was yesterday. It had gone to all of us, Charlie. There was a big response from Michelle about it.
Can I just mention, can I say something about that?
Yeah. Go ahead.
Hi, everybody. So we had actually, the letter came in and then Ian addressed it and said that, they could, apply for a hawker or peddler's license. That wouldn't be a problem. I think the select board asked our attorney to chime in. And if you look at the bottom of the thing, it did say that the Board of Health has the authority to actually, because of a pandemic, to withhold door-to-door solicitation. So the select board decided that we wanted to hear from the Board of Health first before we move forward. And as the letter said from KP Law, that the Board of Health could do something in conjunction with the select board to prevent door-to-door solicitation during the governor's declaring of the pandemic.
But that was sent, I see this from the 11th.
Who emailed who emailed me that document?
I forwarded to you, Charlie.
Can I just clarify, Charlie? No offense. I thought that you had resigned from this committee. Are you a voting member right now?
Yeah, my resignation's not till March 1st.
Oh, okay. Okay. I just want to be clear. I thought that it was February 1st.
No, it was March.
Would you say, Ed? You broke up.
I confirmed that it was, the resignation letter was as of March 1st.
Okay.
All right, thanks.
It says, I see. And in my opinion, therefore, the board may consider the adoption of regulations for hawkers and peddlers at any duly noted public meeting. However, any such regulation should be directed at commercial door-to-door solicitation and avoid regulating non-commercial solicitation.
I'm not going to make any comment because as far as I can tell from my emails, I never received that.
I would feel comfortable saying if they could wait to after the pandemic before we start sending people door to door. I just don't know if that would be with our public. I'm just not sure if everybody would be welcoming to people coming up to their doors. I'm not sure of the distance of what kind of environment that we're inviting people into at this time. So maybe we could revisit it more towards when the Massachusetts starts opening back up again.
Right.
We're not giving them a soft no.
I mean, nothing stopping the select from adopting a temporary resolution prohibiting peddling door-to-door solicitation. Randazzo said that the select board alone could go ahead and consider the adoption of regulations for hawkers and peddlers, any duly noticed public meeting.
I just think it's a stronger argument if the Board of Health supported it along with the Select Board, that's all. What do you think the residents of town will say if someone comes knocking up at their door? I mean.
Well, of course, and it would make them feel uncomfortable. And their argument, I saw somewhere that that they could do it outside, but who wants to spend time outside of their house in the middle of the winter in order to communicate with somebody who's soliciting them?
That's why I say right now just isn't, I don't want to say right now is an appropriate time at all. Maybe more during the springtime. If they, I don't, so I did give this thought earlier, and this might seem crazy or not, and I don't even know if this is an option. But if they had something on the town website and they could set up a Zoom meeting to see what they offer instead of visiting people at their homes, if there was something that they could be like, join us this Friday at 7 for an information session, I mean, it's a way to get their name out there without going to people's houses. So it's not like we're totally blocking them or saying absolutely not. But at this time, I just don't think it's appropriate for them to be in anybody's property. People are quarantined. They don't know who's quarantined. They don't know who they could and can't be talking to. That also poses a problem. We have enough problem trying to keep the quarantining people in quarantine. Like they don't want to be in quarantine.
Becky, it would be a contact tracing nightmare because whoever's knocking on the door is going to be within 6 feet of someone else.
Yeah.
Right.
So, I mean, again, I don't know if that's outside of I don't even know if that's an option for them, but, I've seen, it's definitely a time to get a little bit creative with some selling and some merchant ideas. And I understand that, but maybe they could say, an information session, let's do it like once a month or something like that. And they can, anybody in the town who is interested in it. I do know people aren't interested in it, but then they could set up something saying like, hey, join us this week for question and answer Zoom. And then they can follow up however they deem fit until Massachusetts opens up a little bit more, or there's more, like Caitlin said, nicer weather outside.
The other thing is they could provide written literature that way too. If people express interest, they could send an informational packet to those people, and conduct their conversations, either via phone or through Zoom with that individual too, even if it's not an informational session.
Right.
Well, Michelle Randazzo said she's willing to go ahead and draft the language, both boards.
Yeah, I mean, if the Board of Health would like to work together with the Select Board to move forward on this, that's the first thing we need to know. And if that's the case, I'll reach out to Michelle and ask her to move forward with drafting the language.
I make a motion to move forward and ask Michelle to draft some language that would help move us forward with this.
I'll second that motion unless Charlie wants to jump in.
We good? Jerry, I don't have the agenda. I don't know what happened to it. I can't.
Becky, I'll forward it to you.
Thank you.
All right, so Becky made the motion for KP Law to draft the language, and you seconded it?
Yep.
All right. We need a roll call vote, please.
Can I just ask a clarifying question, just so that when we address it next Tuesday, it'll be clear to us? Were you thinking to just restrict it until some point the governor lifts up the door-to-door solicitation?
The emergency order?
Or for like a month or, whatever?
I wouldn't say a permanent restriction, but I would say definitely until the pandemic or the emergency order is gone.
Okay.
So I think they're going to have to at least wait until that. Like I said, right now, like the school committee is having a hard time with people in the red, and I don't want to complicate things by sending people out to other people's houses.
Okay, thanks.
I emailed it to you, Becky.
Thank you. Thank you. I don't know where this went. So
Need a roll call vote?
Bay, aye.
Brooks, aye.
Abstain.
Okay, so if we can move on to the next item on the agenda, we're going to do the Board of Health updates with the school committee.
That would be Ken from the joint meeting.
You broke up. I don't know if it's me. What did you say? It's something with the joint meeting?
If Caitlin could just give a quick overview of the joint meeting.
Sure. So the question, can you hear me okay? Good. Okay. So the question at hand was whether or not the Board of Health would support the school having an independent contact tracer dedicated to Norris School. And this would work in conjunction with the Board of Health so that way they could have a tracer working only with the school, within the school. And the question was whether or not the school could pay for that and how that would work within the Maven license to be able to provide that service at the school.
You can't separate you can't separate Maven though and have it separate for the school. There's only one system, and all the workflows and all the reports apply to the entire town and to all of Southampton citizens. And I met with the principal the other day to go over some of this with her, so she understood the contact tracing and what was going on. But there's only about 70 days left of school, and by the time a position is advertised, candidates are interviewed, someone's selected, someone is trained and proficient enough to manage Maven on their own, school's going to be out, and they only wanted to do this till the end of school. So it doesn't make sense to try, on top of everything else we're doing, to do that. And I think that, the reason they were a little upset was after Christmas, the numbers were going up. Now the numbers seem to be coming down. And I think, we have a pretty good handle on it. Even contact tracing is doing well. Sharon's doing well. And when I talked to Eliza the other day, I explained to her that in terms of the contact tracing, well, I do that in my report, actually, unless you want me to go through it now.
Well, I think, I think it's important to acknowledge that you went to the state and, there are some confidentiality challenges with expanding contact tracing that were identified. I think that's worth acknowledging. And this person, they were comparing us to Northampton, but I understand that our organizational structure is very different from Northampton, where we don't also supervise the school nurses through the Board of Health, right? They're being supervised outside of the health department. So it just seems like it would be really challenging to get Jerry, you didn't seem like you had a contract in place to be able to make that happen either, right? So it sounds like there would be a lot of changes that would have to be made in order to accommodate this separate plan with the school. And the other thing that got brought up by the school is, they felt like they were being held up to make decisions on whether or not to close classrooms. And I know I talked to Eliza, I know Jerry, you spoke to Eliza, but really it's between the school nurses and who's been identified as a close contact within the school and the principal to make a decision on whether or not classrooms should be open or closed, right? And so they were looking to Sharon to make those decisions, when in reality, those decisions don't have to wait for Sharon. They can send out correspondence to members of the class and kind of work kind of in parallel, right? Sharon's doing her contact tracing at the same time that Eliza can be communicating with the classroom members and making decisions on whether or not a classroom can be closed as soon as the people are identified as a close contact, right? And so I think when we talk to the school committee, they and let them know, like, they don't need to be waiting until every single family member is contacted to make a decision to close a classroom, because I think that's what happened last time. They identified, 18 children potentially as close contacts because they were not socially distanced. And it wasn't until like all of those families were contacted that they were then sending out the correspondence about closing the class. I feel like that conversation with the school committee went pretty well, though. And, that they understood, like, hey, you guys can go and close the classroom once you know that all of these children needed to be quarantined.
I just want to make mention that I did speak to Sharon, and I thought she did a phenomenal job. There was 18 families, of which weren't identified immediately. And the school committee got an answer and her follow-up within less than 24 hours. So they were just, I think it was a lack of communication. And I get it. There's so many moving parts in the school committee that they just kind of lost their footing for a day or two. But Sharon actually really went above and beyond to make sure, I think it was 17 of the 18 families were contacted within that 24-hour time frame. Speaking of, talking about the contact tracer, how the school would want another one solely for Norris, I'm just not sure that with the time left and they don't have a budget for it, they would have to kind of try and find money to get a contact tracer. I'm not sure if they would be able to find somebody and put all the pieces in place to have that kind of efficiency. There were a lot of obstacles that Sharon had to kind of overcome to get where she is now, and she seems to be doing a really amazing job. So pat on her back. I thought, this time in particular, she really did something well.
And the time frame was another question that they had, like, what is a reasonable time frame to complete contact tracing for that number of cases, or if there happened to be an outbreak again? And I did talk to the school committee and said, in the real world, 24 to 36 hours to contact trace that many cases is probably better than the standard. In fact, I said, many cases, people are not getting contacted by a tracer because they don't answer their phone and, people move on and they don't actually end up hearing from anybody. She's making multiple phone calls to each person, making sure she's reaching them. If she doesn't have a correct phone number, which happened with a number of those cases, she actually reached back out to the school to get correct phone numbers for these people, just to make sure that conversation took place. Again, like 36 hours to trace all of those cases is probably a reasonable time frame. And I doubt that you would see, by adding another tracer, I still doubt that it would be even faster than that 24 to 36 hour time frame. And, the other question was whether or not, what would happen if there was an outbreak where there was a large influx of cases. And I know Jerry mentioned that, if there happens to be an influx of cases, there's an existing structure in place to address those things through the CTC. And although the CTC is not perfect, I talked to Sharon about, if a case gets referred to the CTC, she does, and Sharon finds out about it, she does have the ability to reach out through the CTC and take that case back. So if she knows that she doesn't have a case in her queue, she can actually grab that case and take it back and take responsibility for that case. And if she's overwhelmed and there's too many cases, then, the school's going to have to make decisions based upon the information they have, right?
So think that pretty much sums it up about the school. Does anybody have any questions about it or anything that?
No, I don't see a reason to do anything other than keeping the status quo.
Yeah, I agree.
I think it's a much smaller number of students, that we're talking about when we're comparing to Northampton, right? Northampton's a much larger community, and there's a lot more people in Northampton than there are in within the Norris community too. And I looked at the number of cases going back to November when the first cases started popping up, and it's not in the hundreds, right? It's less than 50 cases. So I just it's not a huge number of cases that we're dealing with either.
Okay. Moving on. Miss Health Agent. Hi, Nicole.
Nicole.
Hi. What's going on in your world? Oh, is she muted, Ed?
Are you muted?
Everybody can unmute themselves. But no, she doesn't, actually, Nicole doesn't even show a microphone. So it might be the way she signed on.
Oh, there she is. She's going to audio.
There we go. Got me now?
Yes.
Okay. The weather has definitely slowed down some of the outside stuff. I am scheduling some things for the end of the month right now. As far as perk tests and Title V's, here and there, there's still some. I've started back up on this year's food inspections, try to make sure we get 2 for everybody this year, since last year we got 1 and we sort of went back out as need be because of COVID. So trying to get a jump on some of the stores right now. And other than that, it's pretty much just waiting for the big rush in the spring, which we know is coming. I just talked to one of the guys today and he said, as soon as the ground's not frozen, we've got a few to line up. So, other than that, the animal world has been a little bit busy. I've had some dog bites and some loose animal things the last week or so, which has been thrilling. So other than that, that's pretty much it.
Quiet time for you at least.
A curiosity question.
Yeah.
Food inspection at the school. How's the school handling the food issues?
So Jerry and I were just talking about the school. I've got to go back in and do an inspection for this right now. We haven't been in a little bit because the kids were in and out. So we do need to, that's number 1 on the list, actually.
Is our school still cooking meals, or are they subcontracting to a catering service?
You know that, Jerry?
I don't know that.
Not sure either.
The children are eating in the classroom.
Okay, just so you know, there's a number of schools that I connect with that the University of Massachusetts has been providing catering to the schools instead of the schools making bag lunches. I don't know if it's reached as far south.
I'm not sure about that, but I can call them. I am not aware that there was any catering.
I actually have no idea. I know they offer free lunches to the kids now since they're out, but I don't know.
That's right.
Yeah, I'm trying to think about the last email that I got from them about where it came from.
I know actually they are doing lunches because I remember on one of the meeting, I think John Lum said that they needed to figure out when they were opening because they had to order the food. So they must be they're making lunches there.
Jerry, I'm going to agree with you. I think they are. I remember, I don't know of too many schools out this way that is getting the catering. So I don't think our school's getting catered at all.
I don't think they are either. They're not according to John, but I can check tomorrow.
Okay. Well, enjoy your slow time before it blows up, Nicole, because spring's around the corner and I see there's a lot of lots going up for sale, so.
Nicole,
Yep.
you're all set with the soil classes, right?
With what?
Soil certification classes?
Soil evaluation.
Yeah, my credits are fine for 3 years.
Okay,
The first, yeah, I'm good for now.
okay.
Okay, moving on, Jerry, the health director report. How's things going?
I just received a notice, Mayor in Easthampton and the health director evidently just hit the news that the software that the Commonwealth provided to vaccine clinics crashed. So they can't get into any appointments or do any scheduling until the statewide issue is resolved. So they asked everybody to bear with them. The resulting volume is just unbelievable. Yesterday we received Secretary Sutter's letter, and the administration opened up the vaccine clinics to everyone 65 and over. So everyone began sort of scrambling very quickly. And I'm sure that's the reason why the system crashed. We'll wait until we hear from them. They'll keep everybody posted. But maybe if I give you a copy of this notice that Mayor Narkowitz sent out, we could put it on another red message so that the people understand what's going on.
Yeah, that would be helpful.
I can't believe they didn't let anybody know before I'm just saying, that's to post that as a notice and announce it in the same day. I was like, what?
Yeah, we got the letter yesterday morning, and right after we had sent out over 1,000 letters to all the seniors, some information about the vax clinics. Sent out yesterday the code red message. There were more appointments available for anyone over 75. And within about an hour, we got the letter from the secretary that said we just opened it up to everyone over 65 and be able to make their appointments tomorrow. And I think that happened. It just overloaded the system. So the IT fellows are working overtime on it right now. It's been frustrating for people. I've been getting the call and the emails, and people want to know what's happening, and they just need to be a little patient. I go through and explain to them there really isn't anything I can do point now that the system has crashed. So we'll all just have to be a little bit patient about all of it. We can move into the budget
Jerry,
if you want.
yeah, hold on one second. Janet had a question.
Yeah, I'm just, because I've been trying to get people registered all day, and I just got into the Northampton site. I don't know if it's going to...
Oh, they must have it up.
Yeah, I don't know if it's going to get me all the way through, because I don't want to sign me up for an appointment and I don't have all the information I need, but I was just pleasantly surprised to see it go this far. So I can't commit that it's totally fixed, but I don't want to go any further and register myself for something I'm not ready for. So
Probably one of those things when you get all the way to the end, it says, I'm sorry, error, and you get that spinning wheel of death. Ugh.
the date.
Can we talk about the vaccine registration at maybe after the budget, or I know that you're going through your report, but I know that's a really big priority is to try to figure that out, and how we can support Northampton. So.
Yeah.
Well,
I was going to make a list of everybody that was, 65 and over and try and get phone numbers, Joan. And when I talked to Meredith in Northampton, said, no, don't do it right now. So I'm just holding off for now.
Messages received from any of
most people, when I spoke with Joan, she didn't have very many people that were at that point having any issues. She said people are pretty independent. They've got family members that are signing them up. So I don't know that was really the issue. Really, the software was going to be an issue. And I've helped a few people that need, assistance, but Meredith just wanted me to hold on doing lists, I think. So I'll wait till she tells me different.
Janet, again, go ahead.
Yeah, sorry, I just want to give everybody, so there's been a group of volunteers from this that are members from the senior center, Corey checked individuals that have been making calls over the last 3 days to our 75 and older list. And they have, I would say 95% of them already have their appointments scheduled. So that's good news. And,
that's great.
And we've made probably somewhere between 8 and 10 appointments for people. Now that 65 and over has gone into effect, Joan's phone is ringing off the hook. She's just recommending people call Northampton at this point in time because we don't have a system locally in place, and we can't, certainly unless we have somebody staffed to do, appointment setting, can't really manage the numbers that are coming, that might be coming in. So I just wanted to.
So I looked at what other towns are doing, right? Because I was curious. I'm like, how is this being managed? I looked at Highland Valley, Greater Springfield. Greater Springfield has a dedicated line. Highland Valley does not, right? So there's no elder services dedicated line for Southampton people. I looked at other small towns, and some towns are setting up their own dedicated line. I know we had a call about that last week where we were talking about using a line in the senior center and dedicating that line to just calls and questions about making calls to book people appointments. Then I saw that Meredith said that I would dissuade you from using people that are volunteers. I'm trying to remember what she said. I wouldn't encourage you to use people. I'd encourage you to talk to your town attorney if you're going to have volunteers booking those appointments because it involves confidential information. So I know that there was a question of whether or not we had funds through the PVPC from early on in the pandemic that could be dedicated towards making calls. I guess they were initially designated for a vaccine clinic at some point. And I understand that there's a $2,000 balance in that account. So I didn't know if that would be something that, if we had other ideas for that funds, or if it could be designated to help pay these people to help make appointments, since we don't have, our own phone line.
Actually, that PVPC money was held for contact tracing, but I'm not sure. We might be able to, COA might be able to use some of the CARES Act money, to pay, sorry, the fire department's here. Where was I? I lost my train of thought.
The CARES Act.
We could use the CARES Act. We could use CARES Act money or the COA to pay some, if they have a dedicated line to make, if they're making appointments. But I think clearly we don't know what's happening right now with the software here.
Yeah, and I don't necessarily think it just should fall solely on the COA.
Right, I agree with that.
Be a
But it'd be
joint-
great if we could designate somebody, a person, pay, I don't know what that would look like, but pay somebody to book appointments. I mean, that's like that could be a full-time job. It's a lot of
I
work.
think now it
And
could, now
so
that it's 65
where are they going to be working?
Well, they could
Well-
probably work in the COA outer room because there's space there. I mean,
And we said there's a phone line there too
Yeah,
that could be used.
and there's a phone line
Part
that,
of the problem,
the phone line you can dial out on. I'm not sure you can dial in on it. So it's not like you can call in for
I
that.
think you can call in. It
Book an
just doesn't
appointment.
have the ability to take a message.
Well, then I mean, we don't want them calling on a number that they can't get a message. We can't leave a message. That's not effective.
Well, if you staff it 24 hours a day, you don't have to worry about that.
Well, that's a good point. Unless somebody's on the line and somebody calls while they're on the line, then we're in trouble. But
Well, the other challenges with that was that were identified that unless you have somebody, like we were talking about calling out everybody, okay, we called everybody that's 75 plus, but the challenge is you have to designate a phone number because people are not going to answer random calls from random phone numbers. So, unless people are calling from their own personal cell phones, I don't know how that would work.
but keep in mind that they've all gotten a letter just recently with the information from the Northampton site, including, the link to sign up with the phone number. I'm not sure that you're going to just be repeating. Actually, if we let things slow down just a little bit, and hopefully the software issue, the crash, people will, I guess, be a little more patient. That's a big group, that 65 year and older. That's, the baby boomers. And they're pretty tech savvy. So they're all going to be able to go ahead and sign themselves up as soon as they can get through to that website.
Yeah.
Yeah, I think
At
that's,
least what Joan was telling me.
yeah, I think that's amazing that 95% of our seniors have already been vaccinated. That's a fantastic number. But I will say personally, like there's been a whole bunch of customers that I've had who have used that Northampton number, and they rave reviews. They are so grateful and so happy. And what did Jerry, I think you told me or somebody that they have 27 volunteers a day running that clinic. Like that's an impressive number to have people every day. And aside from having 27 people just running a clinic, they're all communicating and everything just rolls for all the patients that are coming in and coming out, and they have it down. I mean, really, they're doing our town such a huge service. And I think you're right. It's almost like double dipping if we start kind of tweaking that a little bit, and I would feel bad.
I just want to be careful of stepping Meredith's toes because she's got it so well organized, and she didn't want me to go ahead and
It's nice to hear that she said. It's nice to hear that she said to put some brakes on it. To hear that, because last week I will say we were being asked to make the phone calls to people because they were overwhelmed. Right? I mean, that's the call we had. Just what was that last
Friday?
That was less than a week ago, where they were saying like, SOS, please help us because we can't handle the call volume.
So I was thinking about that, and I agree with that. Like, especially when clinics are huge, and there gets to a point where you're just like totally overwhelmed, especially when like you, Caitlin, had to do 3 of the same paper over and over again, like over at your place, like, and at one point in time, everybody's like, I'm done with this. I need help. But then all of a sudden, when you kind of get influxed with all that help, it might not be the kind of help you were looking for. And then you're like, wait a second, let me just gather my thoughts again so we could, do it the right way. So I think we could definitely come up with something to help Meredith, but we need to do it on Meredith's terms, because like I said, that is I've never gotten so much compliments off of something before. And I mean, the people of our town, really, they got in there, 5 people at a time, and I'm talking 0 tech savvy. They can't even open up. They might still have flip phones for all I know. Like, and they were super happy. So
I mean,
I'm willing to do what Meredith tells me to do.
yeah, if that's the direction, then I'll just have Joan continue giving the Northampton number out, because we just want to make sure we're doing the right thing. We were happy to make some appointments, and, you know, we signed up on a wait list probably weeks ago at Northampton, so I'm curious how long it will take them to get to those of us on their wait list.
You know what? I was actually told by somebody yesterday who reached out to me via Facebook, and this was learning for me, but they said that wait list was not to sign you up for the vaccine. It was to sign you up if there was an overage of vaccines in the 75 plus group.
This was 65 plus wait list.
So I'll tell you what the person said to me. I think it would be worth confirming that, because the person that reached out to me said that was not the wait list. It was, here he is. This was just yesterday. I was like, really? Because I thought there was a wait list in Northampton. He said, also, I found out that the wait list I signed up for on January 28th was not a wait list to get in line to schedule an appointment as I thought. The wait list was in case they had extra vaccines available for 65 plus year olds when only 75 plus year olds were eligible.
That's not information that was on their website.
Yeah, I was confused by that too.
There are people that I know that were not 75 who were able to get that shot, and through Northampton. So I guess, you know, and there's been a number of days where the weather hasn't been nice outside, and there were a lot of appointments made that I know of personally of seniors, and they were like, I'm not going. It's icy out today, I'm not driving. So multiply that by however many appointments they had in one day. So I know that they had a lot of extra vaccine doses, and they were making phone calls. So there's, you know, through word of mouth, I heard of a lot of people not 75 who received their shot because of that. So
I wonder if that's what they were talking about, and I don't know that. I think maybe we can find out.
Well, we never got a call from that wait list if that was the case. So.
Yeah, I'm not sure. But then I had personal friends who are right below that 75 mark, who Janet said the same thing, that they're on a wait list for 65 plus. So they were told, and they spoke to somebody actually right before this letter had gone out, and same thing, they're on a wait list for when that group opened up. So maybe there's 2, I don't know. Maybe they're just calling everybody. And at that point, I do believe that there was a lot of appointments that were canceled because of the snowstorms. So maybe they were making some headway just to get rid of the vaccines and not waste them.
Yeah, I mean, I know Renee volunteered at Northampton one evening, but I'm not sure she's accessible at the moment. But they did.
I can tell. But maybe it's worth asking the question, because some people thought they weren't on a wait list. Or like, how are they booking appointments if there's this existing wait list? Wouldn't they first have to prioritize the people who are on that wait list before being able to proceed to the general public? The other thing is, they said that they were posting appointments on the Curative website at 8 o'clock this morning, and that hasn't been done either. So I think that's confusing.
I mean, I don't know if Jerry can find out what that wait list is, so we can help share that information with people. I mean,
I can check with Meredith.
Or what to expect about that wait list, because there's a lot of people who are signed up for that wait list.
And they're not scheduling second shots when you go in for your first shot. It's like they're going to follow up with you. And so I have talked to
They will email you for that second shot. They have all your information, and then within 24 hours or so, you'll get a follow-up mail that tells you the date and time of your second shot.
So, and I'm saying that people I spoke to that had to use their own email because people didn't have an email, didn't receive that. So there may be some confusion about that.
Second shot.
I know that's what I understood to be the case, that they would email you the date of the second shot. But I've spoke to people that are either waiting for their email or use their own email because the people that are trying to register don't have, which I've done, don't have an email. And so that I'll let you know after 24 hours. I'll let you know Monday morning if I got a follow-up email from this person that's registered on my email.
Well, if everything crashed, though, that may have been a problem. So, yeah, let us on Monday and see what happens. But if somebody doesn't have email,
Let's move on from this. We have some follow-ups to do maybe with Meredith and stuff and get some information out, but I presume maybe this is probably going to be a talk as well. So we have the budget next for fiscal year 2022.
Can I just go back to that for 1 second before we change topics? Is that okay? Because there was the question about the PVPC money, and I feel like we didn't answer that. I've heard that question come up 4 or 5 times, so I know it pertains to that topic. It was about $2,000. I think it was $2,000. They were wondering if that money could be used by people who are making calls in the Council on Aging.
that money actually was dedicated and left for contact tracing, though, in case we didn't have contact tracing extended beyond June. Even the CARES Act is extended in December 31st, and I have the information from Ed yet. He hasn't broken it all out. If we have enough money for the contact tracing, will there be money for, I don't know how are you planning on hiring somebody though to do this? The only, as you said, Meredith mentioned that there could be some liability issues, and I know the attorney from Association of Health Board cautioned us in hiring folks to do the registrations.
And if you just want us to go to the Northampton phone number, that's how we'll direct people then. I mean, that's...
Yeah, I haven't got anything back from MAB's attorney, so I can check on that to see what the guidance is on that.
Because I think it's probably more complicated than a phone.
Probably.
I bet it is. Always is. Okay.
Okay.
Jerry, would you mind just repeating what you just said, Jerry, about the attorney?
Yes. Sabara mentioned on one of the conference calls that she cautioned about using volunteers to be careful.
Okay.
In terms of liability issues and, confidentiality with people's private information. She just wanted to make sure we were cautioned, and she was going to get back to us. And I have not heard anything. So I will get in touch with Cheryl and find out what her guidance is on this.
All right. Thank you.
Yep.
Thank you. Sorry.
Yes. Okay, moving on, fiscal year 2022 budget.
Basically, the board is asked to set a budget that is level funded, one with the 2%, I guess, wage increase, and then I think someone said wish list. So I gave you the bit that is level funded with the 2%, and then I itemized the expenses that are pretty much standard that we need to run the department. There isn't any fluff in there. We still have the Sharps program, mosquito program, and those take a fair amount of money, about $3,000 for Sharps, and I think $5,000 for the mosquito program. And trying to find my budget material here. And then I just itemized what we normally spend on trainings, mileage, dues, health officers conference. If we have any hearings, there's legal advertising, office supplies, maintenance of equipment, which is for the dedicated fax line, and cleaning the printers. So it's very straightforward. I don't think there's any fluff in there at all. And clearly, we hope there's more than $500 in the expense line this next time. But I think we'll see what the Finance Committee has to say, and the, Finance team and the Select Board when they put the budget together. I know everybody said it was going to be a tight year, but I thought that the town was going to be getting more money this year than they had previously. So, and I'm just trying to remember, I thought it was 3.5%, but I could be wrong. I did forget one. Well, we can go back to it. I don't know if you had an opportunity to even look at this. It really isn't very exciting at all, to be perfectly honest.
My only question was about the contact tracing, because we had CARES Act money that was for the contact tracer, and I didn't know if that was all going to be covered by the CARES Act funds, because I was under the impression that we couldn't really budget beyond December 31st because CARES Act money was supposed to go away after that time. So I just didn't know if that was something we were going to be able to cover with the existing, budget money that we put into those accounts. Like, I know that there was a salary line, but other than like what we initially requested, I don't know how much of that money's been spent or what's going to be left over. And I mean, there's going to be a need for contact tracing beyond June.
Right, and we're going to need a breakdown of those accounts, and Ed just has the opportunity to do it yet. We have a new accountant, and so he's in the process of being trained. And Ed and I will get together and see what we've got left. And I think we're pretty much okay on PPE. There's only so much of that you buy. It has a shelf life, storage issues. I think we're all right there, although I just saw in the newspaper today that Homeland Security just raided someplace on the East Coast that was peddling fake N95 masks. I don't know if anybody saw that. No?
I did see that.
So they caught up with him. That is terrible. So, but as soon as Ed and I can get together and go through that, I can get something out to you. And I thought, and I can't remember, Caitlin, I thought we had maybe 3,000 left in VPC, but I'm not positive. Quote me.
Okay.
And I have not heard, we may be getting some more money too. I haven't heard from Pioneer Valley. They haven't distributed anything yet.
Okay, and last year,
when I ran the last.
Oh, sorry, go ahead.
The last report, there was 2,500 or 2,600 left in that PVC account, but I'll check it again.
Okay.
Okay.
And last year, it looked like the mosquito money was granted, right? Someone said that money was granted through.
Actually, Matt Rowland gave a gift to the town because there was not enough money for the program. And if we didn't join, if we didn't pay our fair share, we would not be part of the surveillance. And we felt the surveillance was important,
Of course.
but not enough dollars. And Matt very graciously wrote a check.
Okay. So hopefully there'll be enough money for that this year.
Hopefully.
So do we think that there's going to be enough money for mileage? I know that this came up last year. I'm just throwing it out there. I know that when we ran out of money, mileage was an issue, and I just want to make sure that Nicole is going to be fairly compensated for all of her running around.
Well, I think that somewhere Ed will find some money somewhere, I hope, because we have exactly 87 cents left in our expense line, and we have not been able to pay for her mileage for a little while now. Clearly, it's been difficult, but I think the numbers that are in here should be okay. And also, when you do the expenses, you get a total for the Board of Health expenses. It's not broken out and totally dedicated to each line item. You're not, held to that number. So, you've got a little bit of wiggle in there, but if we have to print any new forms, the 3-part forms for doing restaurant inspections and legal advertising, these are just expenses that we've run into in the past.
Of course.
We'll have to wait and see, what other departments are looking for. And I'm sure that, the final decision rests with the Board of Selectmen.
Okay. And then the other thing was the PPE money. I know we haven't really come up with a number, but I remember we allocated a lot of money for PPE, and I just didn't know if maybe, that if we're not going to personally use it, if there was a use for our town to use that PPE money for a different reason. I know that the school was in search of gloves for their staff. So I just, we have that money in an account, and I would hate to see it just go to waste, or not go to waste, but to lose that money if it could be useful for somebody, our town.
I think the money that you might be talking about was that very first cut that Charlie and Ed and John Workman and Illingsworth, I think, and Maureen might have been at that meeting. I'm trying to remember. There was a fair amount of money because we really didn't know what was going to happen, frankly.
It was CARES 2. It was the second round. We added more. We added more money for PPE because we thought that it could be used for either small businesses or for somebody in the town. And I think there was something over $10,000 that, I don't think it's small change. So I don't know, Ed, if it's possible
and you're saying
to take a look at that.
Sure, we'll take a look at it. I can talk with them.
All the COVID expenses are in a big pot. The health department isn't carved out so it's easy to look at. You got to look at all of it.
I understand, but it's not an emergency.
I don't remember an additional request of PPE being approved in phase 2. That's an easy one for me to look at.
Yes, that was what Chris had mentioned, that it was something like $12,000 or something like that. So just let us know.
Sure.
Okay, moving forward. We have other businesses that cannot wait for a posted meeting. Is there anything else that is on anybody's agenda or mind that they need to talk about?
I don't think so.
Cricket?
I don't have anything. Nicole, no?
Did we do any formal vote for submittal budget?
No.
Maybe we should do that?
I make a motion to submit the formal budget. Is everybody happy with it? Everybody had a chance to look at that before you do this?
Oh, I'm ecstatic.
I know you are. Caitlin, are you just as ecstatic as Charlie is?
Extremely.
All right. I make a motion to submit our ecstatic response to the budget for fiscal year 2022.
I'll second.
Brooks, aye.
Dubay, aye.
Konecki, aye. And that way there'll be no question that the board's the ones that submitted the budget.
All right, so I can go ahead and submit that then to the finance committee, the finance, et cetera, everybody.
Yes.
Sounds good.
The second
Okay,
thing is,
before you, go ahead.
the second thing is, do we wish to vote to authorize the director to sign the minutes that we've approved?
Yes. I make a motion to have the director, Jerry, sign the minutes from the last meeting via Zoom.
I'll second that.
I agree.
Roll call vote.
Dubay, aye.
Brooks, aye.
Konecki, aye.
I do have one other thing I'd like to bring up, and we don't have to figure it out today, but there was a grant opportunity that was sent out about regionalizing. Let me actually just pull up the email. Regionalizing or strengthening.
It's public health shared services.
Yes, and so I didn't know if any, it sounded like, Charlie, you had some history with this, and I didn't know if it was something that we would be interested in pursuing.
We had started a dialogue with the city of Easthampton with Amy concerning this, because Amy's also working with East Long Meadow and a neighboring town to do a share program. I originally was appointed by the governor to take and be part of the special legislation to start putting this together. It's not just grants for regionalization, but it's also to take and increase the skill level of the workforce. I still think this board needs to take and entertain some dialogue with neighboring communities, but I don't know, given the pandemic and everything else that's been going on, if this is the time to do it, I guess is the statement I'm making. I've talked to a few other communities that are sort of out there, and they all keep looking at, with the pandemic going, no one has the time to start going into the rest of this. So there's
a big project.
Oh, it's a huge project. I mean, if we were just going to talk off the top here, you're first looking to negotiate with every community that you want to take and link. Once you get that done, then you take and you have to have communications with their select boards or mayors or whoever you're working with and get buy-in there. Once you do that, then you have to take and start looking at going to town meetings or the city council meetings to take and have a formal vote to take and join a district. There's quite a process in this. The last one I was involved in is a mosquito control district, and that took several years. I become a tired old man, and I'm not looking to get into this again. But I do have the resources.
I'm just bringing it up since it's posted on the, as public health shared services with a notice of intent. And if it's not something that you want to, move forward with, then, if it's not the right time, then it's not the right time. I just wanted to make sure we were in agreement with that.
I would suggest waiting a year until we get the pandemic behind us.
And the list of the municipalities there, they're even though they're districts and they're shared services, they're all different. The one in Barnstable County, for instance, that was set up back in the 1920, and they still have county government down here. We abolished our county government here. So, I think that there's going to be some interesting conversation. I agree with Charlie. Wait about a year because this is a huge undertaking.
Okay, I agree.
Okay. So if there's nothing else,
Before I do have one one other thing before you adjourn. This is Charlie's last meeting, and I just wanted to say that we are going to really miss him. And certainly the institutional knowledge, the knowledge he has being the district health officer for many years for the state. I think it's going to be a loss to the town. I understand he's really busy. I'll still see Charlie. We sit on boards together. So I will still see him in the old familiar places.
I want to thank you. I think you were a huge support and definitely a firsthand man. I can always contact you. And even though I said I was going to call you today and I didn't, I'm sorry, but you're always available whenever I had a question. So thank you.
Becky, Caitlin, and Jerry, without saying, if you have a question, send an email, give me a phone call. Don't worry about it. I do this professionally all the time, so I usually have that information that you're searching for.
Yes, and you still are going to get all of the emails that you keep forwarding to me to keep us in the loop about all the grants and all the opportunity. I mean, this is how I heard about this grant. I mean, I'm sure those emails don't just stop because you're not on the board. And so I think that information is really important to keep sharing, and I really appreciate that. You've always been a great resource for me, and definitely have always pointed me in the right direction. So thank you.
Thank you, Charlie.
Well,
thank you for everything.
You're more than welcome. And I guess with that, I move to adjourn the meeting.
I second that.
I agree. Sadly.
Oh, you'll have fun, Caitlin. Don't worry.
All right, guys. 4:38. We're going to close. Thanks, everybody. Have a good one. Bye.
Have a good one. Bye-bye.